Hello, and welcome to the Science on the 7th live stream, a virtual space where we talk about topics related to air quality and health. I'm your host, Pallavi Pant, and welcome back. Tomorrow is the International Day of Clean Air for Blue Skies, the fourth time that we will be celebrating and commemorating this day around the world to talk about air pollution, how we can improve the air quality, and how we can bring blue skies to everyone around the world. Um, Today, I'm very excited to be welcoming two very special guests who've been working on the topic of air pollution and doing some very transformational work. When we think about air pollution and how we're going to address air pollution, we're often thinking about people that may be doing air quality monitoring or modeling, or people who may be trying to come up with solutions. But a very important community that has also been playing a very important role in moving the conversation forward and trying to raise awareness is the healthcare community around the world. Many doctors, nurses, midwives, and other healthcare professionals have started to get involved in the air pollution conversation, both from the point of view of trying to make people understand how exposure can have an impact on their health, and also for doctors and for other healthcare workers to be the people that can advocate for change and become the voice for change, become the voice for cleaner air. So today, I'm very excited to be welcoming Dr. Sunkaru Touray and Dr. Emily Parker. Emily is a pediatric junior doctor, also working as a clinical fellow at the Royal College of Pediatrics and Child Health in the UK as part of their Clean Air Fund partnership. And Sunkaru is a pulmonologist and a critical care physician, also a co-founder of the Clean Air Initiative in the Gambia. Welcome, Emily and Sunkaru. Very nice to have you both here.
Thank you very much, Pallavi. Thanks for the introduction.
Thank you.
Amazing. So for those of you who are listening in, if you have questions for our guests along the way, please feel free to drop them in the comments. We'll try to get them at the end of our session. But Sunkaru, I want to start with you. You grew up in the Gambia, a small country in Africa. You trained in medicine in Ghana and in the US, and you now work across the US and the Gambia. And what you've managed to do in the space of air quality in the Gambia has been really fascinating. So I will let you tell your story in your own words.
Thank you, Pallavi. So, as you said, I trained in Ghana and in the US. And when I finished my training, I started working in New Mexico and West Texas. So that's oil country, right? And so in oil and gas, we're very familiar in the US about the importance of occupational exposure. And through that work, I was involved in sort of a work around the respiratory protection programs for oil workers in Texas and New Mexico. And so I was very familiar with PM2.5, H2S monitoring and stuff like that. And then, I've been going home a lot. I found out that unfortunately in Gambia, there are very few, if any, pulmonologists. And so each time I go home, I see a lot of patients. And over the years, I was able to get some equipment, spirometry, nitric oxide testing. And I do the same evaluations I do in patients there. And I was struck by the number of women in particular who have never smoked. Smoking rates among Gambian women is less than 1%, who had a lot of obstructive lung disease. And, you make you wonder, what is it that they're exposed to, right? In the United States, if you tell me your address, I can tell you air quality in your neighborhood because we have a lot of air sensors everywhere. And so I said, what's air quality like in Gambia? And I couldn't find any information out there. And I thought, wow, that's curious. And so that's how I got started in, okay, let's try to fill that gap. And we started installing sensors, and we've learned quite a bit in that regard in Gambia. So it's been a very fascinating journey trying to get into air pollution work. If I told you that I was going to be doing this in my fellowship, I'll probably be lying to you because I didn't think that this is something I'll be, tackling. But it just happened because I had a question I needed to answer, and I got very frustrated because I didn't have information in Gambia. So.
Very impressive. And I think also, I was just in Nepal a few weeks ago and met with the only pediatric pulmonologist specialist in the country. So clearly, there are many places where there isn't the kind of medical expertise available that we've become so used to. I'm here in the US, right as you are, that we've become used to. And the fact that you're able to do all of that and bring air pollution into the conversation is just really impressive. So congratulations on making that happen. And Emily, I feel like your story is also very inspiring. You grew up in the UK, trained as a pediatric doctor, and you're now an advocate for clean air. You're also an avid cyclist. What inspired you to start thinking about air pollution and climate in your work and integrating that as part of what you do?
So just to clarify, I've actually not started pediatric training. I kind of did a little bit of a bend in the road and went off in the direction of looking at climate change and health. And that's actually the perspective I come from when I'm thinking about air pollution. So I work in pediatrics, but I haven't done training yet, which is something you can do in the UK. I don't think it's so possible in the US. But last year I was doing a job. I was really lucky to get a job in pediatrics that was clinical and had a climate change focus, trying to change clinical practice to reduce the carbon footprint of clinical care, which is something there's quite a lot of awareness about in the UK. And during that fellowship, I was doing a project around inhalers. Because asthma inhalers, I don't know if you guys know this, but asthma inhalers, the Ventolin inhalers and the ones that contain propellant gases are actually really bad for the planet, because these gases are very potent greenhouse gases. There's a lot of work happening in the UK and I think in a lot of other countries to try and change people's inhalers, but which is very important. But also I think I found the context of it needed to be broadened a bit, and I wanted to start thinking about prevention, and that's how I started to think about air pollution. And I guess it sits in the right corner because it's linked to climate change anyway, and I feel that if we can solve that problem at a kind of higher level and at a broader level, then we don't have to worry so much about the inhalers, because there won't be so many people needing them. So that's kind of how I came to it.
Amazing. And I know you're both coming from healthcare settings, so I also want to tell our listeners that we're hearing the opinions of two individuals here who work at their respective institutions but are speaking to us based on their own experiences. And I think, healthcare professionals, of course, have been in quite a bit of limelight, especially with the COVID pandemic, when we saw both the really critical role that the healthcare professionals played, but also the fact that there was so much backlash and questions around, what the healthcare community was doing. And I'm curious on this topic of air pollution, since it is not something that is always on top of doctors' minds or nurses' mind. They're trying to get the patient to be better. That's sort of the first priority. What has been your experience engaging with your peers and colleagues in the healthcare community on this issue of air pollution? What kind of questions do you get? Is there skepticism within the community sometimes? And Sunkaru, I'll come to you first, and then to you, Emily.
Yeah, well, so I think I have two perspectives here. I have the American perspective and a perspective in Gambia. In the US, there's a general understanding that air pollution is harmful, but I don't think that many healthcare professionals know, for instance, that PM 2.5 is a class 1 carcinogen, or that air pollution is associated with cardiovascular outcomes and can actually trigger exacerbations of asthma, and that the information is out there. In America, we have such a density of air quality information. And when you take a social history of a patient, you try to find out where do you live, where do you work, what's your commute like. Simple counseling around behavioral change can have significant impacts in people that have diseases in Gambia. So that's the American perspective. In the Gambia, because there's no data, it's not even a conversation. I mean, when I talk to my colleagues in Gambia about air pollution, they understand it's important, but the strength of the association and also the impact it has in terms of exposure. I make this comment every now and then, albeit somewhat controversially. Smoking rates in Gambia are 16% in men, less than 1% in women. The proportion of Gambian population that's exposed to toxic air is much larger. So in terms of the population at risk exposure, it's considerable. And when we start thinking about public health messaging, I feel like there's a lot of opportunity for us healthcare professionals to take a more active role in kind of counseling our patients, because they actually, despite all the skepticism, I think in Gambia in particular, doctors are still, and healthcare professionals are still, the advice is listened to more so than here in America. And so I think that there's a lot of opportunity in Gambia to lead that discussion. But no skepticism. I think even within the public healthcare sector, it's a lot of interest. I think the limitation in Gambia has been the fact that until we started doing ground monitoring, there was just no data. So we're hoping that we can use data to bridge that gap in policy. And I think that's one of the objectives of our Clean Air Initiative.
Emily, what about you? What's your experience been like talking about air pollution with other healthcare practitioners?
Well, I think it's really interesting that you mentioned COVID, because I think there's a mixture of responses. I think some healthcare practitioners are so burnt out by how challenging the work itself has become that it feels like there isn't space to think about broader issues apart from what's right in front of them, and that's totally understandable. But I think there are other groups that are really motivated, and it actually informs their practice a lot and keeps them motivated to work and makes them feel like they're doing something meaningful. I think a really big challenge, actually, is, I don't know what it's like in other kind of medical education environments, but for me, I think when I was reflecting on my medical education, I really felt like this didn't feature very highly. And I think the way we conceptualize of a patient is very contained as one individual. And the curriculum tries to make us think a bit further than that, but there's not that much time because we're learning all of the pathophysiology and everything else. And I think that changes how we see our role, and it changes where we see our power. So sometimes it can be quite uncomfortable to think about these broader issues because we don't really know what our role is in relation to them. And maybe we think the boundaries of our role stay at the edges of the hospital, and we don't kind of step into that next zone. So I think maybe that's a challenge, but it's also a really big opportunity for people to feel like they're able to stop people getting sick and stop people coming back in a different way. So yeah.
No, that actually makes, that makes a lot of sense. Often, even when we're talking about air pollution as an issue, a common quip by many people is, why don't people care that air pollution is a problem that's affecting them, especially in low and middle income countries? And, the truth of the matter is, I have plenty to worry about outside of air pollution, food, livelihood, money, making sure my kids are okay, that if air pollution is just an added thing, I'm not, it's fine. It can happen at its own pace. But it is really heartening to see so many people, and, Sunkaru, as you mentioned, a lot of people in many places still place a lot of emphasis on what a doctor is telling them. And they're more likely to believe it than they're likely to believe a scientist or someone who's just, crunched through some data. In fact, a few months ago, we spoke with Dr. Alexander Simichiev, who's in Bulgaria, also a physician, worked in medicine for a long time, and then realized that air pollution was a problem. He ended up setting a similar group in the country, and he actually went one step ahead. He ran for elections and went to the parliament so he could really work on air pollution and climate. So I think there's like a whole spectrum of how people are getting engaged on this issue. But outside of the healthcare community, I'm sure you also work with patients and you meet with people that are not necessarily trained physicians or healthcare practitioners. How is the experience talking to them about air pollution? Often we hear from our doctors about diet and physical activity and the importance of doing it. When you talk to people about air pollution, what's their reaction and what kind of questions do you get from them? Sunkaru, I'll come to you first.
Yeah, so that's a very important question. So, we know about the 5 risk factors for non-communicable diseases, right? So you mentioned, diet, physical inactivity, alcohol. When you're doing counseling generally with patients, you would touch on those things. The one thing we don't touch on generally is air pollution, right? In Gambia, though, one of the most insightful things that I found practicing there is the importance of domestic energy in air pollution. So more than 95% of households in Gambia use firewood or charcoal to cook. And that goes to Emily's point earlier about climate change, because where do you get charcoal? They cut trees down. And if you know how to make charcoal, you burn the charcoal in a big bonfire. So you cause air pollution in doing that. And then the charcoal gets packaged in sacks that get sold. And they're taken to homes where they are either used as firewood or for cooking in the house. And it's because of the traditional role in Gambia, there's some gender issues there around women primarily being, home workers, homemakers that cook at home and they have little children around them. We see that there's an inequity there in terms of women being disadvantaged, disproportionately exposed to harmful effects of air pollution. So for me, it's no longer just about air pollution. It's also about deforestation. It's about, desertification. It's about climate change. All of those things tie into why the patient is having, respiratory problems. And so for me, my question is, how do you navigate a just energy transition in a country like Gambia, where 95% of households cannot afford to buy cleaner energy sources for cooking? And I think that's one of the biggest epiphanies I've had working so far. And that's the conversation that I bring to the policymakers at the Environment Agency and the Ministry of Health, and also among the politicians that I have had conversations with, is that, guys, we need to think about slowing down deforestation and desertification. And by doing that, also finding alternatives like subsidies for cleaner energy, so we can start educating our patients about that. And so when I get a sense of what the patient can afford, you have to try to really have a personal conversation and tailor the recommendation to what you think the patient can do, because it's really not appropriate for me to tell them, look, stop using firewood or charcoal. They'll tell me this doctor doesn't really understand what he's talking about, right? But for those that can afford it, I try to explain to them how that affects them. And there's a practice in Gambia where we burn incense. It's called Touray. It's a form of aromatherapy. And I got a bit of flack for saying that was actually bad for patients. For people who have children with asthma or who have very bad asthma, they know that. They will not burn incense in their house. But if you say that as a public health messaging, I think that's the way you have to be very careful as a healthcare professional about how you craft messaging before you are seen as trying to, challenge their culture. But I think as doctors, we have an important role to play in how we, share information with patients and engage in shared decision-making around making them understand the link between the environment, their health, and the climate. We'll have some papers coming out soon for the first time based on continuous ground monitoring in Gambia that indicates that as PM2.5 increases in the dry season, the number of admissions and visits for pneumonia increases. So now we can begin to talk with data that is actually context appropriate, that can begin to draw the attention of policymakers in that regard. So for our first State of Air Quality report is actually coming out in the next few months, just based on the data we have that's written by the Environment Agency. And I made sure I highlighted that and also to talk to the energy minister. So you find that the solutions for what we're dealing with as doctors to your colleague in Bulgaria may not necessarily lie at the bedside, but might lie in parliament or in the powerful offices in our respective countries, because changing from firewood to cleaner energy stoves requires some national policy decision-making that as a doctor, I'm not trained or qualified to do. But I think I can add my voice as a professional to show the impact in terms of human lives and, years lost and, quality of life issues that are important. So my goal as a physician, as a, co-founder of the Lung Institute, is to actually be a scientific advisory body to that discussion in Gambia.
Yeah. I think you're raising so many points that are worth much longer conversations, especially that issue of where, the scientific understanding of air pollution and cultures collides, because incense burning is also very common in India. People do it for religious reasons, and I can't tell my mother to stop doing it. She will disown me if I do that. So I've been trying for many years. I'm making very slow progress. So definitely there is that part of like the what's ingrained in our cultures, what we think is things that we want to do. Emily, I'm curious from your perspective, what is your experience, especially as someone who's navigating medicine and work on air pollution and climate change? What kind of questions or conversations do you tend to see very often?
Yeah, it's a really interesting one. I wish I had time to respond to all of the interesting points that Sunkaru has brought up, but I'll stick to the question because I know we're short on time.
Oh, please do respond. I think we want this cross-pollination of ideas. So please take your time to respond.
Well, one thing I wanted to say is I think you would be very qualified to be a policymaker. And I think we need more health professionals in the policy world. And that's one of the kind of bridges that my job at the Royal College of Paediatrics and Child Health is helping me to understand, because one of the things I've been doing with them is writing a position statement for them as an organisation on air pollution, with some policy calls for the government based on child health and air pollution. And there were lots of other things you said I wanted to respond to, but they've gone out of my mind now. So, but yeah, in terms of seeing patients, I think for me as a clinician, I find it actually less uncomfortable than talking about diet and smoking and exercise, because I think we underestimate the impact of environments on health, and it's very hard to have a conversation about diet and bring in the environmental problems of diet, access to healthy food, costs, and all of that. So you end up feeling like you're telling the patient off for a behavior that they're doing, when actually it's not really as simple as that. Whereas with air pollution, I think it's much easier to explain that this isn't something that's fully within their control, but we can hopefully give them some information that might help them to make different choices. So walking to school away from a main road, or understanding that if you sit in your car and the engine's on in front of you, and you don't block off the external air from coming in, that you are exposing everyone in the car to air pollution. And hopefully that will encourage people not to drive so much. And I think patients are generally quite interested to hear that stuff. And I've definitely noticed with indoor air pollution that often families are already aware. So I think that's the slightly difficult side of it, that's where you kind of engage with the powerlessness of a clinician. And as you're saying, Sunkaru, about fuels and people not having money to change their fuels, and what do you do then? But the patients are normally already aware of the mold and damp in their home. That's the problem we have in the UK. And normally they know that that's causing health issues. And I think it can be quite a relief for someone to actually recognise that. Then the challenge is, how do we counter that? And we've asked in our policy position statement with the Royal College for attention to the need for ventilation and fuel cost assistance. So I guess maybe we can say, as a doctor, I will support you by pushing for this at a government level. Yeah, it's a real challenge, but I do think that patients are sometimes relieved when they get recognition for that.
No, that's important. And what you said about mold actually reminded me that when I lived in the UK, one of my rental leases had a requirement that I had to open windows every single day to ensure that there would be no mold in the house. So that it's clearly like a more ingrained issue that people are more aware of. I think beyond the sort of science and the policy work that you're both doing, this tends to be, since you have full professional lives and you're doing all this work in addition to it, I'm curious what got you, what got you interested in this, and what is it that is giving you hope to continue working on this? Like, what do you see as some signs of optimism or change that you're hoping to hold on to as you continue this work forward? And Emily, maybe I'll come to you first, and then Sunkaru, come to you.
So I'm going to refer to some of the data from the Clean Air Fund in relation to this. They did some really interesting research. I'm not sure what year, but I think it was quite recent, looking at the barriers and drivers to action, healthcare community action on air pollution. And a lot of the drivers are to do with kind of feeling like you're part of something, feeling like you're part of something bigger, feeling like you have efficacy. So if you can move people away from the feeling of powerlessness and point them towards how they can be effective and how powerful our voices are as healthcare professionals, then I think there's a lot of hope. It's something we're working very hard on at the Royal College of Paediatrics, and we've got lots of things coming out in the next few months to help pediatricians understand air pollution, understand its effect on child health, and use their voices. So that's my hope, is that the health voice is going to be stronger, and it's going to also be an exciting thing for healthcare professionals to be involved with.
Sunkaru, what about you?
So for me, the cause for optimism stems from the fact that in Gambia, at least, we're a very young country, like most of Africa. The average Gambian is 19 years old. They're mostly digital natives. They are connected. They know what they want. And many patients that I see, compared to older patients that I care for, want to take an active role in their healthcare. And one of the things that we do at Premier Health is we actually have a patient platform where we try to bring patients together and we kind of discuss these things with them. We had a workshop a few months ago where we brought people from volunteers in the community to start organize them into patient advocacy groups so that they can begin to make a demand for change. To Emily's point around that, I think also for us in Gambia, we're very optimistic because we went from no monitors to nationwide coverage in 18 months. And we're going to have longitudinal data for a long period of time that would give us the ability to actually talk to our partners at the Environment Agency and also the Environment Council that actually advises the President and the Parliament on what can be done about this. So I'm really looking forward to leveraging that level of engagement we have from the government in Gambia. But I think it goes to a broader conversation around not just in Gambia. I hope that we would navigate a just energy transition away from, wood stoves and fossil fuels. That's a very important discussion that has to be had. And so I think, the next decade or so is going to be very influential in that regard. So I think young population, vibrant, educated, connected.
I really want to learn how you got all those monitors out so quickly. I think we need to have a separate meeting and we can get your tips.
Yeah, I think it's been actually very, very fascinating what Sunkaru has managed to do in the Gambia. And I know we posted a link to some of his work, but anyone who's listening, and also if you're interested, do look up what they've managed to do in a relatively short period of time. Hopefully there's lessons for other places to replicate some of it.
Yeah, I think I want to shout out to the Energy Policy Institute for giving us support with the Clean Air Award. But the whole thing that started this idea was I just put up sensors. 1 sensor, 2 sensor make a lot of noise. 3 sensors, 4 sensors make a lot of noise. And then it sounded like a joke initially, but it's taking a life form of its own. So yeah, I'm happy to connect with you at any time.
Amazing. And I think also, this notion of getting access to even limited amounts of data and that leading to change over time. We've seen this happen in so many places now, starting all the way from China when the US Embassy was putting out data publicly to, in Pakistan, there was one person who started putting out sensors and started tweeting about it. And suddenly this was like starting to become an issue that's really important. Something similar seems to have happened in the Gambia. So there is clearly power in, making data and information available to people. And I think that's a really useful message in light of the fact that tomorrow is the Clean Air Day, and we're talking about investing more in clean air solutions. But I think for today's conversation also, just as we're hitting our 30-minute mark, I would like to hear from you just in a short sentence, if possible. What is your message to other, fellow healthcare community peers and colleagues on the topic of air pollution? Either something that we should all be paying attention to or a call to action, whatever you would like. What would be that, one message to your peers in the field? Emily, I'll come to you first and then come to you, Sunkaru.
I think I would just say to explore it, learn about how many parts of the body it impacts, because you'll be surprised.
I think also the similar thing, just spend some time getting familiar with the science. It's actually a lot of recent data coming out in the last decade, just looking at the link between air pollution and health. And also, I think getting patients that we care for to be active participants in this process. There's a saying in America, if you ain't at the table, you're on the menu. So we need to get the patients to be at the table so we can have conversations to address this issue. They're more likely to have success if we are partnering with our patients than we are if we go and speak individually, especially in the current environment of scientific skepticism.
Amazing. Thank you both. I think what I'm taking away from this conversation is a few different things. One is we really need the healthcare community to be very involved and engaged in this. Also, maybe we need some more thinking on how we message around air pollution, especially in different cultural contexts and in what is acceptable and considered to be sort of normal activities. And also this continued learning and understanding of the variety of ways in which we know air pollution affects health, and also the variety of solutions that we know exist and can help us get to cleaner air. Thank you so very much, Sunkaru and Emily. We are very grateful you could make time to join us today. And both of you are doing very amazing, inspirational work. So please keep at it. There's a lot more we need to do. And we will be following, things you both do in the future. And everyone listening in, thank you very much. Don't forget that we will be meeting again on Friday, September 27th for a Science on the 27th. This is the rescheduled chat with Dr. Mark Miller from August, and we will talk about air pollution and heart health. So do tune in then. And until then, I hope you have a wonderful weekend and enjoy blue skies and clean air if you have access to those. And for the rest of us, we'll keep working towards it. Thank you very much.